Bone tissue. Bone is the calcified connective tissue that is responsible for supporting the body structure and protecting internal organs. Unlike other tissues in the body, bones are capable of regeneration, repair, and remodeling after an injury, and is referred to as the ultimate smart material. Bone tissue is a site for hematopoiesis, which is the process of creating new blood cells. Bone tissue also stores calcium, phosphate ions, and important growth factors. Pathologies of the issue include fractures and breaks, skeletal deformations, such as congenital disorders at birth and results of incident, osteoporosis, osteoarthritis, osteomyelitis, which is the inflammation of the bone as a result of infection from the bloodstream or nearby tissue, Paget's disease, which is a disorder of cells called osteoblasts and osteoclasts that are responsible for breaking down, rebuilding, and remolding bone tissue, and causes bones to become thickened and enlarged, but also brittle due to abnormal structural development. Bone cancer, leukemia, osteosarcoma, and fibrous dysplasia, the excessive growth or swelling due to abnormal cell development. Impact on individuals. Fractures and broken bones are among the most common orthopedic problems. Approximately 6.8 million cases come to medical attention each year. The average citizen in a developed country can expect to sustain 2 fractures over the course of their lifetime. Approximately 6.3 million fractures occur each year in the U.S. Skeletal defects occur in approximately 1 in every 130 births.
Because this is such a large issue, there are current treatments in place today. These include a caster splint, which resets the bone and immobilizes to allow for time to heal, but some resetting cases involve metal rods. There's surgery, which is inconvenient and invasive. There's anti-resorptive therapy, which includes drugs like biphosphonates that reduce bone breakdown and decrease UCOC levels, which could also lead to type 2 diabetes. There's anabolic therapy, which helps build new bone to reduce the risk of fracture, but also there's bone grafts, which include autografts and allografts, which foster new bone growth in the body, but these can lead to pain, infection, and immune rejection.
Cost of bone treatments and surgery. In general, this depends on the location or the type of the surgery being performed. On average, surgery can cost about $25,000 to $30,000, including consultation fees. This is normally for patients who have had to be hospitalized for 3 to 4 days. If surgery is performed under general or local anesthesia, there will be an additional cost of $4,000 to $6,000. Outpatient surgeries are $15,000 to $20,000. Our remedy approach 1 deals with synthetic tissue scaffolds, which is a structure of natural or artificial materials on which tissue is grown to mimic a biological process outside the body or to replace a diseased or damaged tissue inside the body. It's also a temporary scaffold that is used as an adhesive substrate for the implanted cells and a physical support to guide the formation of new bone. Scaffolds are biocompatible, biodegradable, and highly porous to allow for new cells to settle in the structural matrix and grow. Cells seeded into these scaffolds grow, eventually replacing the biodegradable scaffolds as they decay. So here we see some pictures exhibiting this type of remedy. So this type of regenerative therapy starts with a scaffold piece or structural matrix, as shown in Figure A, that is seeded with cells and implanted into the patient. These scaffolds are typically porous, so that cells can seed inside them. So like in Figure B, we can see these pores in an up-close view, and in Figure C, it depicts the material that these are made of, so like an up-close view of this. Some barriers and limitations of Approach 1 are the nature of scaffold therapies means that it will take time for the new bone cells to settle into their matrix and form new functional tissues. Moreover, there is a potential problem of running out of donor cells with which to seed the scaffold structures. Current methods are still in the experimental stage regarding ways to get nutrients to and remove wastes from the growing cells in the scaffolds. And techniques for such nourishment, like vascularization, which is like getting blood vessels, inside are active areas of research in scaffold and tissue engineering.
The second remedy approach is the biomaterials approach. This involves using osteoinductive materials that induce bone reformation by stimulating its in vivo environment. An example of these osteoinductive materials is calcium phosphate. Another biomaterial often used is hydrogels, and these are matrices for tissue engineering. There are a couple different types of hydrogels. One of them is natural, and that comprises of gels made of collagen, nanocellulose, and gelatin. The next is synthesized, and that involves ethylene glycol and vinyl alcohol-based gels. An example of one of these synthesized hydrogels is Rad16I. This is a self-assembling peptide that gels and forms a nanofiber network upon implantation. It is proven to be non-aminogenic and biodegradable, as well as safely breaking down into amino acids in the body that can be cleared in vivo. Some limitations of the biomaterials approach is that these materials take time for new functional tissues to grow. The current biomaterials also lack potential design or complex material geometry. An example of this is shown in Rad16I, which is highly condition dependent, which means that it needs a certain environment in order to be successful. It is also soluble at low millimolar concentrations, and an addition of salt could disrupt the intramolecular electrostatic interactions.
One more remedy approach is 3D printed implants. One example of this is 3D printed grafts that are made from a material known as hyperelastic bone. This means that it's elastic and can stimulate new bone growth in patients. It's made from a hydroxyapatite, which is a mineral found in bones and teeth and is a biodegradable polymer, similar to the functionality of a scaffold used to concentrate growing cells around a fracture. And then there's also another example of 3D printed implants is a CT bone, which is real bone from a 3D printer. They're often used by those with facial asymmetry resulting from either trauma or congenital defects. Its typical bone augmentation implants are made from alloplastic materials like PEEK or titanium, and CT bone is a bone-like customized implant that can be 3D printed and then converted to real bone by the patient. When implanted, CT bone unifies with the patient's own bone within the next few months. Here's a look at some 3D printed bone implants. Figure 1 is an example of the hyperelastic bone, and Figure 2 and 3 shows example of the real CT bone. There are some current limitations with the 3D printed bones. The functionality of the polymer used in the 3D printed grafts is still largely in the experimental stage. The main challenge here consists of getting new polymer viscosity just right. The solution needs to be suitable to get flow from the printer head, but not have the bone particles fall out of the solution. Potential of invasive surgery to place the 3D printed bones inside of a patient's body is also another limitation. The use is limited to a specific set or type of bones in the body. The creation of many bone types has not been attempted since complications or deficiencies in the current technology makes it incapable of the accuracy and detail needed to make these bones.
In conclusion, as one of society's most common medical problems, there is a good deal of research going into the study of how we can repair bones in the best possible way. It is also logical to want to implement strategies and approaches that are minimally invasive and biologically satisfactory. With its focus on biomaterials and biomechanics, biomedical engineering offers optimal potential for creating solutions for bone repair and healing.